Hey, there's a topic that I want to bring more attention to. We talked about Kratom on This Week in Pharmacy, which was just this past Friday. But my team of resource distributors, as well as marketers and educators, and all of this facilitation that you bring, Josh and Steve, welcome back. It's so good to see you.
Good to see you too, Todd.
So, Cannabis Pharmacy Network, we're going to be digging deeper into cannabis and CBD, specifically around disease states where it really makes sense, where we're already seeing a lot of feedback from our medication experts, our pharmacists out in the field, out throughout the nation. But there's other supplements that we're super curious about: Kava, Kratom, the psychedelic world, and Cannabis Pharmacy Network is going to continue to do nothing but network with people throughout the nation that we trust. One of those people is Dr. Christopher McCurdy. Christopher, it's so good to see you.
Thank you. Thanks for having me here. I'm excited to share some information with all of you.
Yeah, and like I said, this is the beginning. This is not the catch-all. We would have to be here for hours and hours talking today. So this little 20-minute, 30-minute discussion is just a highlight. It's also a call to action. Everyone listening, pharmacists out there, if you understand Kratom specifically, if you've heard more about it, if you're curious about it, if you want to work with the Cannabis Pharmacy Network, please reach out to us. This is why the Pharmacy Podcast Network is 15 years in the making, the most successful podcast network in the entire healthcare industry dedicated to pharmacists. It's because you pharmacists continuously drive information through this network for other pharmacists and technicians and also business professionals. That's another important part, an aspect of this, Josh and Steve, is the fact that we can find, research, and then source credible products that we believe in, and that's been a missing link to this relationship through the Pharmacy Podcast Network. Tell us just a little bit, just for the new year, about the Cannabis Pharmacy Network and what your mission is, Josh and Steve.
Hey, Todd, thanks so much for having us on. Dr. McCurdy, thanks for joining us as well. Really excited to have you share with some of our pharmacists and some of the listeners out there. Steve and I work directly with about 700 community pharmacists, and about 6 or 8 months ago, we started getting asked about Kratom. We didn't know much about it, but a few of the patients had started asking the pharmacists, and so we started doing some research and found that hardly any of the pharmacists knew a lot about it. And so just kind of Googling around, we found Dr. McCurdy, and man, he seems to know it. And so we reached out to him and just said, hey, help us educate and share about Kratom as we're all learning. And so we're really excited to have him as a part of just helping share and get some answers for some of the pharmacists that we work with and some of the other medical professionals out there about Kratom in general.
Yeah, and really we feel so strongly here about sourcing any incredible plant materials that we can use to help you and your patients live better and live healthier. First, foremost, and always, obviously, safety is huge for us. We're big into COAs. We're big into researching the companies that we work with. And then at the end of the day, what we're trying to bring to the table is something reliable and something credible to use as a cash-based business for these independent community pharmacies. We know that obviously the times are changing. Anything we can do to bring in more revenue for our pharmacies, that is what we are here to do. And we just like to make sure that we vet it and get all the industry experts to the table that we can, which is how we found Dr. McCurdy.
Absolutely, absolutely. So, all eyes and ears on you, Dr. McCurdy. Could you kind of give our listeners, just give an overview, your background, and the fact that you're tied into the University of Florida College of Pharmacy as well?
Yeah, sure. Thanks again for bringing me on. This is really important part of my mission these days, is trying to get as much education out there around this material as possible, because it's become so popular so quickly. And we've been researching it for almost 20 years, long before even the DEA knew what it was about, or the FDA. So just to quickly give a brief background of myself, I'm a pharmacist as well. I got a BS in pharmacy from Ohio Northern University, then went to earn a Ph.D. at the University of Georgia, did a 3-year postdoctoral stint at the University of Minnesota College of Pharmacy, then began my career at the University of Mississippi as an assistant professor, rose through the ranks there. 16 years later, I left there to go to the University of Florida, and now I'm Associate Dean of Faculty Development, Professor of Medicinal Chemistry, and I also run a Translational Drug Development Center for the University of Florida. All of that to say that a large portion of our research, as I mentioned, for the past 20 years and really more in the last 5 years, since we've had an influx of money from the National Institutes of Health, focused on kratom. What is it? What can we learn about it? Pharmacologically, therapeutically, safety, harm, all the things that we were curious about, that the government's curious about, and of course, the more important point is the consumer.
Absolutely. Yeah, we want to bring this education to pharmacists, but then continue to push specific to conditions, specific to treatments that can be used as substitution of something else or in conjunction with something. There was a article that came out through JAMA Network. It was just published on January 26th of 2024. And it was in the substance use and addiction section of the network of the publication. It said ecological momentary assessment of self-reported kratom use effects and motivations among U.S. adults. And we've talked about this research that has come out recently. Chris, can you kind of give our listeners as to what was shifted from not knowing to knowing, what's happened in the educational side of things? What does this paper specifically touch on?
So this paper was the first of its kind. It's really something that has never been done in the kratom space. So ecological momentary assessments are really used when patients or users are taking a substance, and you can actually record in real time what their interest is in taking that substance, what they're taking it for, how often they're taking it, how often they feel they need to use it. They can give you sort of real-time data in terms of how they feel, what their experience is. And then we also did random sort of text messages or prompts where they could just enter what their mood was, what their feeling was. We always like to look at the beginning of the day and the end of the day with these individuals to record exactly what was going on. And so as part of this, and this is the main publication of the study and sort of how it was designed and what happened. But we've got a couple other sub-site studies that will come out of this. One of which is we were the laboratory at the University of Florida. We were the ones that were able to analyze over 350 products from the marketplace. This will be the largest field analysis of purchased products from your typical place that it's purchased from today, which are gas stations or smoke shops, vape shops, or over the internet. And so to have that large of a sample size to analyze, compare, contrast, and really dive into what the chemical components and constituencies are is another paper that'll be coming out in the near future. We also were able to do 10 of these patients in this study as inpatient subjects. So we actually drew their blood and we've collected their urine. We'll be looking at sort of blood levels of the different alkaloids, urine levels of metabolites and alkaloids, and then getting a good idea of what those individuals that have been taking kratom for a long time, what does this look like at steady state, more or less, in the subject? Because most all of the data that's out there these days has been acute, and it's been in animals or even some of the human trials that have been done that haven't been published yet. Again, were acute settings. So people took single doses animals receive single doses, and we looked at pharmacokinetics and behavior after that. So no one has caught it in the real world scenario like this paper has. And it was, I think, important enough that even the Journal of American Medical Association realized they need to get some education and information out to medical practitioners. And this was sort of a surprise to us that they actually were interested in this paper, but I think it also shows you the relevance of what's happening right now and understanding what's there. So that paper that just came out in JAMA Open actually looked at over 13,000 individual Kratom events. So these were recorded messages or recorded. They took a dose on this time of day or that time of day, and then each of those doses, as I mentioned, had some sort of subjective sort of tie to them as to what happened. And this occurred in full over a 15-day period. So these individuals that were involved were involved for a couple of weeks, and it was great to have that type of study come out, because there's nothing else like it in the kratom space right now.
So we know just from light reading as well as reference from the team at the Cannabis Pharmacy Network that kratom is a tropical tree. It's native to the Southeast Asia area, and the consumption of the leaves produce stimulant effects in those low doses, but then sedative effects in high doses. Can you talk to us about the two major psychoactive ingredients in kratom and kind of describe that to the listeners?
Sure. So I think what's important right now is that we have studied as a scientific community, and the emphasis has been placed on these two compounds, one of which mitragynine or mitragynine, depending on if you like tomatoes or tomatoes. It's basically the same compound. It's the major alkaloid that's present in the plant. And in general, when we see plants, pharmacognosists would tell you that if there's a very abundant chemical in that plant, it's probably the active component. And so also, since it's the most abundant component, it's the most easily purified and sort of quantified. So we can get, our lab generates several grams of that per week, extracting from leaf material. And that's been the major focus of studies. I would say 90+% of the literature studies have focused on this single alkaloid, and that single alkaloid has been completely removed from the whole plant material. So no one is taking the single alkaloid. Everyone's that's taking kratom products is taking a full plant product. And so it's important to have that sort of as a reference point. We're looking at this what I call complex symphony orchestra of a plant that has many different alkaloids within it, the major one being this mitragynine. And we take it out and we listen to it at full blast, and forget that it's in concert with all these other alkaloids. And the other alkaloid that's received a lot of attention, but much less than mitragynine, is actually its metabolite called 7-hydroxymitragynine. And so just to give you a quick chemistry pharmacology lesson, what we see is mitragynine interacts with opioid receptors, it interacts with serotonin receptors, it interacts with adrenergic receptors. And so you've got a molecule that's got complex pharmacology just in itself. But when it's metabolized by the intestine and the liver by cytochrome P450 3A4, it actually converts into this 7-hydroxy metabolite, which has only opioid receptor activity. And it has very potent opioid receptor activity. But the good news is there's only a small amount that is produced by metabolism. And what's been interesting in the literature and what has shown is mitragynine actually has the potential to serve as a single chemical treatment for opioid use disorder. And so when you put these things together, it's very possible that the mitragynine, which is in much higher concentration, is canceling out the effects of the 7-hydroxymitragynine when it's present together. We don't know what ratios. We don't know very much of the science in that detail, but we also know that there's at least 3 or 4 other alkaloids that are important that haven't been really detailed and published on very much. And those compounds are sort of the second, third, and fourth most abundant alkaloids in the plant. And as I said, we've had a spotlight on those 2. But we're going to start seeing data emerge on these other ones, one of which is called speciosialatin, that interacts with opioid receptors as well as adrenergic receptors, and again can be an interesting treatment for opioid use disorder itself. And then there's a couple other molecules, painanthine and speciogynin, that look very similar to each other and have high affinity at serotonin receptors. And so this could be where some of the mood elevation and sort of stimulant effects are coming from within the plant. So it could be the adrenergic and the serotonergic components, but there's a lot more than just the 2 compounds that everybody has been focusing on for the last few years.
What about the effects, Chris? Can you go into some of the low dose and then higher dose effects that have been documented?
Yeah. So what we've learned from a lot of interviews with human subjects is that less is more in the case of Kratom. And so individuals that seem to be benefiting at the greatest degree from this plant are taking low doses. They're taking less than 2 grams or 3 grams at a dose. Some are taking 500 milligrams in a dose, and I'm talking about just bulk leaf powder, which there's several forms of Kratom available. We should touch on some of that as well. But really, people that are taking capsules or people that are taking powdered forms, they're trying to keep their use down. They're using, like I said, anywhere from 500 milligrams to a few grams per dose. And when you start to get to those levels, you're getting some reports of pain relief, particularly chronic pain relief. You're getting reports of increased activity. So whereas many of these individuals might have been taking opioids before opioids or depressants, they sort of, take care of the pain, but you also don't feel like doing much of anything. And we've had many emails and many conversations with individuals that say Kratom was the first thing that actually touched on their pain, but also got them to carry out their daily job or their home duties, and be back engaged with their families and feeling good about contributing like they would have before they had chronic pain. Other individuals are using those low doses to really increase their focus, to decrease their anxiety, almost not analogous to an attention deficit disorder treatment, but certainly helping people to calm down, focus, and be a little bit more socially engaged as well. And then there's the reports out of Southeast Asia that it can be nature's Viagra. And so there is not only some of the stimulant type effect that we think of just as energy, but a lot of individuals report that this helps give them more stamina and more life, let's just say. So that's there. And then as you get to the higher doses, as doses increase, you actually end up starting to get more of a euphoric, not a euphoric feeling like you're getting high, but just a really good feeling. And unfortunately, a lot of people have confused that with getting high or having a legal high and have tried to push doses so high that they're running into some side effects, so what we call the wobbles, where they actually start to get rapid eye movement. They'll start to lose a little bit of coordination, dizziness. We almost wonder if it's like serotonin syndrome or a stimulant like overdose. And interestingly enough, when people are calling in to poison control centers, if they've had a little too much, they would identify with more symptoms of what look like stimulant overdose than anything else. And so this could very well be related to the serotonin adrenergic activity that may be taking over at those really high doses. And then we can, unfortunately get into situations where people end up in the ED and they've had a lot too much and need to be dealt with in that case. And unfortunately, that's where most of our medical human literature is out of single case reports that have shown up in emergency departments because individuals have overconsumed a product. And again, we know nothing about what the proper dosing should be or where the limits really are, other than to say, we come back to this less is more, and we're getting good reports and good outcomes from people who are using as low dose as possible to get the benefit they're seeking.
Dr. McCurdy, can you give us the difference between what you're saying as a low dose versus what has been reported in the high dose milligram or whatever measurement that you want to share with our listeners?
Yeah, so in the low dose range, typical dose anywhere from 2 to 5 grams of leaf material. And I said, some people are down as even low as 500 milligrams. Some are doing that once a day, once every other day. The half-life seems to be, for most of these alkaloids, in the neighborhood of about 24 hours. We do know that individuals in Southeast Asia will consume teas or chew the leaves off the trees about 3 times a day. So they'll use it in the morning, the afternoon, and in the evening or late afternoon. And again, it's more or less for that stimulant effect, that being able to work out in the hot sun, or laborers. This is all in rural parts of Thailand and Malaysia, and actually where the border of peninsular Malaysia and Thailand meet is sort of ground zero for where this tree originated from. And so that's pretty much in line. The use of the traditional methodology is pretty much in line with these lower dose experiences that we hear about in the United States, with these 500 milligrams to a couple of grams in a single dose. Some people are pushing as much as 5 grams, and we would still consider that to be sort of in the normal range of responsible use, although we don't really have a definition scientifically of what those ranges are. I have had emails from individuals that are taking 90 grams a day in divided doses at 30 grams a shot. And that's definitely with some problems where they will run into issues of really trying to get off of the substance and not being able to get off of it as easy as many that use just small amounts say it's easy to stop and not use. That the sort of feeling is that when they're using low doses, they feel more like it's a caffeine type of dependency, where if you don't have it, you kind of are a little more grumpy and maybe have a headache, but it's not going to be the end of your day. Whereas some of these individuals that are consuming really high amounts, like I said, I've even heard of most recently an individual that was taking 220 capsules a day, which if they were 1 gram capsules, that's an unbelievable amount of material. If they were 500 milligrams, it's still an unbelievable amount of material, because you're talking about 110 grams of kratom in a day versus someone who may be taking, like I said, 500 milligrams once a day or every other day, or someone that might be taking 2 or 3 grams 3 times a day, you're still less than 10 grams, right? Now you talk to somebody who's taking 10 times that amount in leaf material. So, and it's different for everybody. So you obviously, most people that are totally naive to it, and when we talk to people in Southeast Asia, the most typical thing if you get too much is you have nausea and vomiting. And that's pretty much if you're naive to it. There is a tolerance that develops. It takes a long time, a much slower time to develop the tolerance to the effects of it than an opioid would take, for sure. It's not truly an opioid. A lot of people have the misconception that it is an opioid product. The FDA stance on it is that it's an unregulated opioid product. I think the FDA's tune may change a little bit. They just completed their first clinical safety trial. The data is not available yet, but I think they were surprised at how little adverse events they saw in a single ascending dose trial. So that's going to be shared at the College on Problems of Drug Dependence this summer, their study and their data.
All right. So as of right now, what's the legal status throughout the country with regards to Kratom?
And so right now it's legal and it's federally illegal. So there is no federal restriction on Kratom. There are some states that have outlawed it. There's 6 states that have banned Kratom products. There have been many other states that banned Kratom products, but they've also been states that have listened to the science and started to see what's happening, and they've reversed those bans to provide individuals with access again. There are certain municipalities within other states that have banned products, and I can say that I've spoken to law enforcement pretty much all over the country, and there's concern that kids can just go into a gas station and purchase a concentrated extract shot and consume it and be very sick very fast, because I think that just brings us to the point of the legality issues. Where we are right now is a completely gray space. So there's no, as I said, there's no federal oversight in the regulation, so to speak. The FDA does have import bans on the material coming into the United States, but once it's passed and into the United States, it can be sold and utilized. It's just not supposed to be imported in. And we do know that there's at least, this is pre-COVID numbers. In 2019, we knew there was about 2,000 metric tons per month coming into the United States. And we know based on sales today that that's much greater. We have an estimated predicted population that's using around 15 to 20 million individuals. The Kratom industry is worth billions of dollars, and there's really no oversight on it. And so there are companies that are trying to do the right things by getting their products tested, by putting COAs out, by putting ingredient labels on the bottles, putting warning labels on the bottles, and whatnot on how not to use it or how to use it. But unfortunately, there's places that I've seen people walk out with Ziploc bags that just have written on Sharpie marker Kratom on it, and that's out there. And so it's a frightening from that sense. And many states have been looking into enacting what's called the Kratom Consumer Protection Act. Florida enacted that last year, where actually only that restricted the age of sales in the state. Now there's another bill that's been introduced in Florida to start requiring labeling and certain other aspects to protect the consumers. We're going to start to see this, I think, more and more commonplace across the country. In fact, more states have enacted the Consumer Protection Act than have banned Kratom at this point. So There is some industry self-regulation, but it's really not enough. And as far as we know right now, the DEA has no intention to put the material into the Controlled Substances Act. And they want to see more science. And that's why the National Institute on Drug Abuse has been funding a lot of grants. They've funded over $60+ million worth of grants now to study Kratom. And what we're learning from all of those studies is there's lots of potential, not only in humans, but actually in the veterinary medicine space. We're doing a clinical trial at Florida on osteoarthritis in dogs. Many dogs get hip dysplasia, particularly Labradors, our favorite dog in America, and those dogs really don't have much option. And so what we're seeing is some really promising success so far with controlled clinical trials around that. So we're hoping that there's going to be some more scientific studies that may push Kratom into a botanical drug route that could end up in very clinically controlled dose use setting, but in no way does anybody who's researching the product for therapeutic benefit want to see it removed from the marketplace access that it currently has now. We just want to be able to have some legitimate prescribable ways to use it.
And Doc, something I wanted to jump in and ask just for the listeners out there, just because I know it was very confusing for me at first when we started learning about all this. There are several companies out there that instead of using whole plant material, they are refining it down to one or two of those main alkaloids, specifically the metrogeny or the mitragynine. Just for the listeners out there, obviously we discussed the 500 mg to 2 or 3 gram dosage being the appropriate range. If it is a product that's just the MIT, just the metrogeny, what are the doses you see in that are going to be the most appropriate for a beginner or for someone looking to treat those symptoms?
Yeah, it's a really difficult number to put exact dosages on. But I would say that if we look at there being about, there's in the neighborhood of 25 to 30 milligrams of mitragynine in a gram of leaf material. Now that could vary. Okay. That could vary. But if we then think of a 2 gram as, say, your typical dose, so we've kind of drawn a line at 50 milligrams of mitragynine in the maximal dose, so to speak. What someone might consume then at over 3 times a day, obviously coming out to be about 150 milligrams on the top end of what we would consider to be generally recognized anecdotally as safe. I can't say scientifically that it's safe at all because we don't have that data, but that's kind of where things have gone, and many of the products out there would fall within that if they're leaf material even, or some of the purified concentrates even still fall within that area, or isolates per dose, right? So it just depends on how it's being looked at, how it's being taken care of. I did mention we want to touch on these different products, as you just mentioned, though. So we really have the leaf material that's very finely ground powder that can be used bulk or encapsulated. There's tablets that are available as well from the whole leaf material. Then there are extracts, and the extracts really tend to remove much of the plant material and focus on having mostly alkaloidal content. So all those different chemicals I was talking about earlier, of course, the metrogynine or mitragynine in there, the 7-hydroxy, the other compounds that would be available in that. And what you start to see is those products start to vary from being sort of less concentrated to super concentrated. And then to get them super concentrated, sometimes they have to be put into different solvents like ethanol or things that will change the absorption properties or the exposure properties so that, even though it's concentrated and you're getting more, you're actually having a way that is more solubilized and more freely absorbed into the blood, which also gets us into a higher risk of something harmful happening or danger happening faster. It's not as easy as sort of the more controlled, defined doses that we can be aware of. So there is this very different product landscape out there. I would say and recommend no one ever, as their first experience, try a concentrated extract, just because that's like having your first experience with alcohol, taking a shot of Everclear, versus having a beer, with your buddies. It's a very different experience, and so those are the kind of things that we talk about, particularly naive users or people that will be starting out. As lowest is best.
Yep. All right. So Josh and Steve, we always want to lead with science. However, there's always the first organizations and people and people that study that are out there actually able to obtain and try out such products. Talk to us about, Cannabis Pharmacy Network has always been innovative. You've always been able to bring high quality products to people that wanted to assess, try, and even stock for those areas that it's really working, especially the condition that it's working in. But where does the network stand right now with Kratom? Are you getting close to choosing a product or a service to be able to start out with?
Well, it's been about 8 months or more we've been looking. I will say that we're really excited about leading with the same thing we do with our cannabis products, investigating the manufacturers, creating a relationship with them, making sure all the products have a COA, have a lot number, have an expiration date. We work with over 25 manufacturers currently with over 300 SKUs as a company. And we're bringing on probably 2 or 3 Kratom manufacturers. Those 2 also fall into the same guidelines that we have. Just like Dr. McCurdy was talking about, there'll be low dose products that'll be easy to kind of start with for most beginning users. And we're just excited about something that's new into the space, because back in 2017, nobody was selling cannabis inside the pharmacies either. We were some of the first people that walked into pharmacies trying to teach them about CBD and these products. And so no different. I'd ask the pharmacists and listeners out there, if you've got questions, reach out to us. If you want to try a sample of some of the products, reach out to us. We're here to try to open the conversation about Kratom and Kratom and make sure that the pharmacists know that they can get questions answered or a tested quality product.
Dr. McCurdy, this is just the start. We expect to have you back on many different discussions as we move forward with more education that we start to apply to different conditions, different disease states, and where Kratom can best be leveraged, as well as a mix of things where I see in the future. I see a pharmacist really being able to customize therapy depending if you're having sleep issues, you're having pain issues, you're nervous disorders, senior care. So we're going to be very curious and very open to having you back, Chris. We really appreciate you being here.
Yeah, thank you all for having me, and I'm happy to come back anytime. Hopefully, as the science keeps moving forward, we keep having more information to give you as well.
Absolutely. Josh and Steve, thank you again for bringing us such a great resource in Dr. McCurdy and referenceable, and we're always educating. We're always seeking. We're always very curious, and we want to uncover everything that we can for our pharmacists out there, because we know pharmacists are trusted throughout their communities, and we want pharmacists to be packed with information. So I want to thank you both for doing this today.
Thanks, Phil. We appreciate you guys.
Thank you, Doc.
We'll see y'all soon.
And listeners, thank you for listening. If you have anything on Kratom that you'd like to send to us and or be a reference for, please reach out to Pharmacy Podcast at pharmacypodcast.com. And with that, we'll talk to you guys soon.
Thanks, y'all. Have a great week.
Thanks, Doc.